other thing I wanted to ask about, so say I find, a great clinical trial and I'm eligible and I enroll, but for some reason or other, I end up leaving the clinical trial. It's just not working for me for one reason or another. Will my regular oncologist go back to treating me? Is that what I do when I leave a clinical trial?
I think that brings back the concept of team effort because this is a team effort, whether you're being taken care of by your primary oncologist or by your clinical trial team. What I always tell my patients is that they should try to maintain active contact with their primary oncologist. And then there is added responsibility on the clinical trial team also to update the primary oncologist or the primary provider with regards to how the patient is doing on the clinical trial. It could just be a simple 5-minute phone call or a 2-line email that would suffice. Because one of the major advantages here is there is no lack of communication. There are instances when an individual may not do that well on a clinical trial, and then it's always reasonable that they can go back to their primary oncologist or a primary provider who can take it from there if they need to go on a standard of care treatment. But for that to happen, I think it's very important to maintain those lines of communication, whether it's between the patient or the primary provider or between the clinical trial team and the primary provider. So again, it's a team effort, and I think it's always reasonable if you feel that if an individual feels they're not doing well in the clinical trial, they can go back to their primary provider as long as the primary provider is up to speed about what is happening and how things have gone on the clinical trial.
I'll add just that, for example, if you were on let's say a phase 1 clinical trial and you unfortunately had a side effect that caused you to withdraw, often the clinical trial team will still be following along with you, even if you're no longer receiving the study drug, because they want to make sure that your side effects have resolved and that you're not going to have any worsening side effects. So even though you may officially, be withdrawn from the trial or they're no longer receiving the study drug, they will likely still be checking in with you and seeing how you're doing, not just in terms of did the problem resolve, but also just making sure again that they often check to see, for example, your disease state, because that actually helps with the long-term data for any clinical trial. Because if we just stop following anyone who had a bad side effect, that would give us a false level of data in terms of people who dropped out of the trial.
Absolutely. I'm glad that Dr. Chino brought this up. These are two different terms that we use. One is off treatment and the second is off study. So off study is generally longer than off treatment because once an individual is off treatment, they are followed for a certain duration of time until we can define that their toxicity that we assume or assign is related to the drug that has completely gone away. If it's not fatal toxicity, that is. So it's very important to follow these individuals, these patients, for a certain duration of time until that side effect resolves. So that sort of monitoring is always going on in the background.
That's great, and that's very helpful to know about.